Good morning. It's Tom Chase, and today our special guest is Dr. Michelle Fontenelle. Good morning, doctor.
Good morning.
And Dr. Fontenelle is a child and adolescent psychiatrist and medical director of Life Bridge Kids, a new psychiatric clinic in Las Vegas. And we're going to be speaking about depression and even suicide in children and youth. So tell us about Life Bridge, first of all.
Well, LifeBridge is a new child and adolescent psychiatric clinic. We're just getting started. We're going to take children from the ages of 3 and up. The goal is to address all of their needs, not just psychiatric needs, but also to make sure that there's integration with schools and psychologists and other people who are providing care for the child, because we want to be very comprehensive. And I think that's really a needed service because a lot of places aren't able to do that kind of coordinated care.
Mm-hmm. And physically located out towards Summerlin?
We are in Summerlin, in Tivoli Village.
I was checking out the website. It does look like a real comprehensive clinic. So tell us a little about your training and your current practice.
Okay, well, I did my medical school at the University of Maryland. Then I went on to Shepherd Prep for my psychiatry residency and learned psychiatry there. Then I went on to Children's Hospital in Boston, which is affiliated with Harvard Medical School. In addition, I actually went back and studied health policy at the Johns Hopkins School of Public Health, because I think that mental health is not only an individual concern but also a public health issue. And so that was what prompted me to become more involved in some of the policy pieces and knowing that the collaboration needs to be key for children and adolescents. So currently I'm the medical director at LifeBridge, and we're trying to, like I said, address the full comprehensive needs of children.
Now, a child psychiatrist, I honestly haven't run into very many of you over the years. Is that a fairly, it's obviously a very specialized field?
It is a very specialized field, and yes, there are not that many of us.
We're fortunate to have you here in Las Vegas. So, now this is a question coming from a layman, of course. When is it time for a child to see an adolescent psychiatrist? Because aren't a lot of the characteristics of being an adolescent also the same things that you might want someone to see a psychiatrist over and not really be that abnormal?
Sure. There's some things, the moodiness and that kind of thing that you see, the kind of oppositional behaviors that you'll come to see in adolescence, but when it's very pervasive, so your child has lost interest in doing things, they're all doom and gloom, their appetite changes, their concentration changes, their energy, they're feeling worthless or express a lot of things about guilt. And when they really focus on death or talk about suicide, those are the things for sure that you want to make sure that you attend to.
The suicide among adolescents is really becoming a national issue, isn't it? It seems like it's constantly in the headlines.
Right. I think also with the increase in bullying, and we're noticing with social media that sometimes that is cyberbullying. There has been an increase in suicide, the attention to suicide. But the interesting thing is that Nevada actually has a fairly high suicide rate amongst all comers. Suicide rate in Nevada is the 5th highest in the country.
Really?
And with regard to children and adolescents, it's the 3rd leading cause of death. So this is a crucial issue. There was recently a study done in the state, which is called the Youth Behavioral Risk Survey, that's done every 2 years. And what they found was that in the state of Nevada, for high school students, approximately 1/3 of them had reported depression symptoms in the last 12 months. A full 20%, which is extremely alarming, had contemplated suicide on a kind of really thinking about it.
Really?
Seriously thinking about it. So that's major. One of the other things that we found was that 17% actually came up with a plan and 12% actually attempted.
Gee.
So, these numbers are tremendous to really take, when you try and take them in, that this is a significant issue, especially in Nevada.
And it sounds like it catches some parents by surprise. So even as well as you may know your child, there may be a lot of thoughts that you're not aware of, huh?
Yeah, I think, again, adolescence is one of those times where they tend to speak more to their friends than they'll speak to their parents. But it is still very important that parents continue to be in their child's life, even if there's that push. but just to make sure that the child understands that they care and they, love them in spite of that adolescent angst that they're going through.
Are there specific warning signs you think that a parent can watch for that might be an indicator that this isn't just being a moody teenager and slamming a bedroom door?
Like I said, some of the symptoms would include a 2-week period of really depressed mood where they just lose interest in doing almost anything. Their sleep patterns can change. Some kids will actually sleep more. They'll become the hibernating bear where they won't sleep, or they'll sleep forever. And then you'll have some who can't sleep at all. You'll have some that don't eat. Then you'll also have some that eat a lot. The energy level can change. It can either be even very low where they don't want to get off the couch, they don't want to do anything, but on the other side, they can be very fidgety and don't know what to do with themselves. They're just kind of feeling like they're crawling out of their skin. They can express, feeling guilty about the littlest things. They spilt milk. Oh, it's so terrible. How did I do that? I'm so stupid. I always mess up. They have trouble with concentration. So school, especially a student who's done very well, now all of a sudden their grades are declining and they're just losing all the interest in school as well as their ability to function at school. Then again, suicide is a big thing, even if they're not expressing to their family member suicide, some of the darkness comes across and they're talking about death, or they're even focusing on people who have died. So those are some of the major things that parents want to be looking for. And again, it's that pervasiveness. It's not just a moment here where they say, oh, I'm thinking about somebody dying. It's when it becomes this sort of doom and gloom where it's all the time.
So, along with the warning signs of depression and suicidal thoughts, what are some of the other big flags that a person really needs to pay attention to?
One of the biggest flags is if a child has already had an attempt, because what we know is that between 20 and 50% of people who have actually completed a suicide have a history of suicide attempts in the past. So it's really important for parents not to just look at these as cries for help, because sometimes it's more than a cry for help. They really do intend on killing themselves. And yes, they don't succeed that first time, but they still really want to. So it's really important for a child who's had previous suicide attempts, even if parents have thought of it as a cry for help, that they monitor them even more closely.
So you really can't ignore it when people start talking about suicide. You can't just write it off as, they're being dramatic.
Right. It's really, it's the temptation is to do that a lot of times. But it's really important. And another important thing to note is that sometimes girls make attempts more, but boys actually complete more. So although it's really important to obviously to pay attention to your daughters who have suicidal thoughts, it's especially important with your sons.
What kind of are there government and insurance aids for people if they find themselves in a situation where they think that their young person needs to seek help? Do most insurance plans cover that kind of treatment?
Actually, as part of the ACA, it is required that mental health coverage be included with all of the other services. So as of this year, people have options. Now, for people who don't have insurance, there is always the safety nets. There are what's called community mental health centers. So parents can always take their children to those places if they don't have any insurance.
It's not necessarily regarding adolescent mental health issues, but doesn't Las Vegas itself have sort of a mental health problem?
It does. Like I said, there's significant rates of suicide in the state. There's significant rates of depression. Gambling addiction is obviously one that's more specific to Nevada. But yes, there's also a lot of stigma whether you're here or anywhere else. So that adds to the problem of people getting their mental health needs addressed.
And I think I read that a lot of our emergency rooms get filled up with mental health crises.
Yes, that is currently the state of Nevada at this point. There are a lot of difficulties. They've closed one of the state facilities. We don't have enough beds for people, so they are being housed in the emergency rooms, unfortunately.
Sounds like a very inefficient, less than ideal treatment facility. Yeah.
It is, but I think I'm ever the optimist
Uh-huh.
and believer that the system may be a little bit broken right now, but it can be fixed.
Well, again, we're speaking with Michelle Fontenelle. She's the doctor, child and adolescent psychiatrist and medical director of Life Bridge Kids, the new psychiatric clinic here in Las Vegas. And one more time for your website.
Our website is www.lifebridgekids.com.
What is the general age group of patients that you might see?
Well, our goal is to see children primarily from 5 and up, but for children with autism, because I do specialize in children with not only general mental health issues, but specifically autism, where that diagnosis, it's crucial that they get diagnosed earlier. Then I will see them as young as 3.
So, wasn't there just a recent news article about the increase in autism rates, and they were trying to determine whether or not that is just because we're getting a better handle on diagnoses, or is it an actual increase in the syndrome?
Yeah, and I think that's still, the jury's still out on that. I think that there is better diagnosis of the disorder. I think in the past, a lot of people would just be considered quirky, as opposed to actually recognizing that they had a disability or different ability, as I sometimes call it, with autism. And so, and there's actually some studies that indicate that part of the reason why we think there is probably an increase in autism rates is because of people having their children later.
Oh.
So advanced paternal age is one of the things that they've noticed that may be increasing the number of children with autism, which kind of makes sense because in our society we really have switched over to having children, getting married later and having children later.
So back to the issue of a parent of a teen who is apparently having problems. Do you have any like screening opportunities? Can you have them come in for like initial interviews and visits and just help them determine whether or not, no, this is normal adolescence or?
Oh yeah, they are definitely welcome to come to our clinic to have their child assessed. It's fairly comprehensive. Again, that's my goal, is to be very comprehensive and get as much information about what's going on with the child, in the family, what's going on in the school, especially something like bullying, trying to figure all the pieces out to determine what is actually going on. Is this just a moody teen? Are they even just dealing with some issues of bullying in school, but they're not necessarily depressed, but working in the whole context of the child's life and trying to determine what's the diagnosis, what's going on, and what's the best treatment option.
I'm just curious, when an adolescent starts seeing you or someone at the clinic, do they become the patient, and then is your confidentiality allied with them as opposed to the parent, or how does that work?
Okay. For children and adolescents, it's crucial that they feel like they can express what they need to and be a safe, secure environment. So in general, I will tell the parents as well as the patient that in that room, it is you and I. And we are discussing whatever, we discuss. I will only disclose to your parents things without your permission that would involve harm to yourself or harm to anyone else. Other than that, I believe it's important for the therapeutic relationship to be kept in the room. What I sometimes, though, will do if I really have concerns, not necessarily that there's self-harm or harm to someone else, what I'll actually do is have the adolescent try to speak to their parent. And sometimes it may be to actually have them in the session, so it gives that, I'm sort of in the middle, so that they may feel like they have that confidant there to support them in whatever it is that they have to express to the parent.
Now, if if a patient is suffering depression, let's say you have a teenager who's had all the signs of depression, what are treatment options for depression when it comes to an adolescent?
Okay. Well, going through the entire life experience of people, when you look at children younger than 12, preteens, what you're finding is that for them, therapy is the major thing to try first. And they actually have the best outcomes with therapy. When I get to adolescence, it's a little bit different. Some can do well with medications, some can do well with therapy, and I'm an advocate for doing both because I think you work on both the biology as well as the psychosocial at the same time.
So on the young side, probably not so much medication
Not
and
so much
prescriptions. Yeah.
medication.
So LifeBridge is a new facility. You've been open about a month,
We've been open for about a month.
I see. And could you give us your web address so that listeners could find out more?
Sure, it's www.lifebridgekids.com.
Well, we've been chatting with Dr. Michelle Fontenelle, child and adolescent psychiatrist and medical director of LifeBridge Kids, a new psychiatric clinic here in Las Vegas. And with everything we read about, children having difficulties, especially with bullying and suicide in Nevada, it's obviously a great resource, and we're glad you're here. Thank you so much for your time this morning, Doctor.
Thank you for having us.